A political row has flared up after the violation of lockdown orders by Kapil Wadhwan of DHFL Group and 22 other people. Hitting out at the Maharashtra government, BJP leader and former Chief Minister Devendra Fadnavis asked if there is no restriction for mighty and rich in the state. Meanwhile, Home Minister Anil Deshmukh said that his senior IPS officer has been sent on compulsory leave for allowing DHFL promoters Kapil and Dheeraj Wadhwan to travel despite the ongoing lockdown. Prime Minister Modi holds a video conference with all state chief ministers today, and later he may address the nation to convey the government's decision on the lockdown. Reports say the lockdown will be extended, but with many changes this time. Some sector-specific relaxation of norms may be allowed while keeping social distancing in place. 50% of the workforce in some services may be allowed to return. Staff may be rotated every several days. A roadmap for the days ahead is awaited. The centre has asked all states and union territories to ramp up the number of samples collected across the country for testing to at least 2.5 lakhs by April the 14th. As India enters the last week of the 21-day lockdown, and the centre has now made a push for more tests to map the outbreak, with more testing to understand what trajectory it's taking. Reports quoting a source said that 1 lakh samples were collected in India, and by April 14th, this needs to be taken up to 2.5 lakh samples. While endorsing the Supreme Court order for free testing, private labs have called upon the government to come up with modalities so that their service remains sustainable. The centre had fixed a price cap of Rs 4,500 on each test for the 65 private labs that were approved. After the Supreme Court ordered tests to be free, labs say they incur costs on reagents and consumables and of PPEs for staff. They have sought clarity on who will cover these costs. The Indian Council for Medical Research is in the final stages of framing a protocol to infuse the plasma of a recovered patient into a COVID-19 infected patient in order to boost the immunity and improve chances of recovery. This will only be done by way of a clinical trial in patients in a severe condition or on ventilator support, ICMR officials clarified. After approval from the Drug Controller General of India, the therapy will be done on a trial basis. China on Friday reported a fall in new COVID-19 cases, including imported ones. 42 new cases were reported in the mainland on Friday, compared with 63 cases a day earlier, putting total infections at 81,907. Globally, the number of coronavirus cases rose to nearly 1.4 million, with the death toll around 95,000. More than 350,000 people have recovered from the virus infection till now globally. The UN Secretary General Antonio Guterres addressed the powerful UN Security Council and flagged that the current pandemic could give non-state actors access to virulent strains of the disease and create terror around the globe. The UNSC for the first time discussed the coronavirus crisis in a closed video conference session on Thursday. Guterres said the COVID-19 pandemic has provided a window into how a bioterrorist attack might unfold across the world.